Necrotic enteritis is a profit killer in poultry production. It's attributed to the cause of a loss of more than $6 billion every year in global poultry production. This controllable disease is on the rise. One reason is the voluntary or legally required reduction of antibiotics in animal production due to the increasing occurrence of antimicrobial resistance, but also consumer demand. Another reason is the administration of live coccidiosis vaccines and partial reduction of ionophores, which also show efficacy against gram-positive bacteria. Necrotic enteritis and coccidiosis are the most significant health problems in broilers. The disease generally occurs in broilers chicken of 2 to 6 weeks of age. It is caused by an overgrowth of Clostridium perfringens type A and to a lesser extent type C in the small intestine. The toxins produced by C. perfringens also damage the intestinal wall. So as we continue, we're going to be calling necrotic enteritis NE. Clinical and subclinical forms of NE. Which one causes most significant losses? The clinical form is obvious. It's characterized by acute dark diarrhea resulting in wet litter and suddenly increasing flock mortality of up to 1% per day after the first clinical sign appear, sometimes summing up to mortality rate of 50%. The birds have ruffled feathers, lethargy, and inappetence. Necropsy typically shows ballooned small intestines with a raft-appearing mucosal surface, lesions, and brownish pseudomembranes. There is a lot of watery brown, blood-tinged fluid, and a foul odor during postmortem examination. The liver is dark, swollen, and firm, and the gallbladder is distended. In the case of paracute necrotic enteritis, birds may die without showing any preliminary signs. The subclinical form often only can be noticed at the end of the cycle. When birds suffer from the subclinical form, chronic damage to the intestinal mucosa and an increased quantity of mucus in the small intestine lead to impaired digestion and absorption of nutrients, resulting in poor growth performance. The deteriorated feed conversion and the resulting decreased performance become noticeable around day 35 of age, as feed contributes approximately 65 to 75% of the input cost to produce a broiler chicken. Poor feed conversion increases production costs and significantly influences profitability. Often, due to lack of clear symptoms, this subclinical disease remains untreated and permanently impacts the efficiency of production. What causes NE? The pathogen causing NE are ambiguous bacterium. Clostridia primarily occurs in the soil where organic substances are degraded in sewage and in the gastrointestinal tract of animals and humans. These bacteria produce spores which are extremely resistant to environmental impact, heat, irradiation, exscation, some disinfectants, and can survive for several years under suitable conditions. C. perfringens spores can even proliferate in feed or litter. Clostridium perfringens is a natural inhabitant of the intestine of chickens. In healthy birds, it occurs in the mixture of diverse strains. The disease starts with C. perfringens proliferates in the small intestines, usually due to a combination of factors such as high amount protein, low immunity, and an imbalance in the gut flora. Then the number rises. How can you manage and prevent this disease? Dietary management. Optimize diet to reduce unindigested protein reaching the hind gut. Coccidiosis control. Manage Eimeria infections effectively. Hygiene. Strict farm hygiene and good building climate control. Gut health. Maintain good gut health. Maintain gut integrity through probiotics, prebiotics, and organic acids. Vaccination. Vaccine for coccidiosis can reduce any risks. How do you treat if you have to? That is, if your birds are already infected. Medicated water is what you should use. Antibiotics like bacitracin, penicillin, or ilimicillin in drinking water. Now that you know about necrotic enteritis in poultry, you can protect your birds better.